Well, community partnerships is how local neighbourhoods can get involved in the health and social care integration agenda. In other words, all coming together, the local authority, NHS partners and the voluntary community faith sector, all coming together to start making a difference on the ground in our local neighbourhoods. So you're probably familiar with the fact that we've got an integrated care system with an ICB, an integrated care board that's looking after Cheshire and Merseyside. Then you've got a place, which ours is Cheshire West place, and then there are neighbourhoods, of which there are nine community partnership neighbourhoods in our place. Recently, Place has agreed that the community sector should be the one that are driving community partnerships, which of course I fundamentally agree. So as Cheshire West Voluntary Action CEO, I've been going to these Place meetings regularly for the past 2 years now, as the third sector representative. And we've built trusted relationships where we now think it's about time that the community sector drove community partnerships. Seems to make sense, doesn't it? So Cheshire West Voluntary Action have been given the budget, been given the responsibility to bring together all these community partnerships. They were already existing, but we've re-energised what's going on. I know we can make a difference, so I want to make sure that Place and the ICB get to hear the message of the difference that we're making in terms of people's health inequalities. So that's the first thing. The second thing is that I think what's the crux of the matter is that lots of people involved in caring for people on the ground are not in touch with each other. So the local authority, social workers, etc., the hospital, rapids and reablement services, the community nurses, the voluntary community faith sector, not really linked up. So somebody can be supported by one or other of these individual organisations and people coming in and out. And what we're trying to do is actually have a wrap around the person, wrap around the family service that makes sense, where we also as a sector, the voluntary community faith sector, can heavily be involved in early intervention and prevention. It's better, isn't it, for us to stop people jumping in the river than having to then pull them out. In other words, we don't want people to get to a situation of crisis. We want to help support them before it gets there.